now and write notes on what I'm gonna talk about.
I'm going to interrupt
Okay.
you 1 second.
Sure.
If you note,
For now and write notes on what I'm gonna talk about.
I'm going to interrupt
Okay.
you 1 second.
Sure.
If you note,
Intake form. But if you don't have one, this is a great one to kind of use as a reference, so you'll all get that. And you can,
what we're going to cover,
Yeah.
the topics, and there's a briefing on each side of it. It's inside your phone. You have it there, Maya.
Yeah, I do.
And then you could write notes, okay?
you're missing something?
No, it's coming around.
Okay, let's make sure everybody has. The second little packet, not everybody has yet, but he's gonna print them out, okay?
Rotem just called and texted, and she's on her way, but she'll be here about 11:40.
Well,
Okay.
All right.
No, we're just going over paperwork, so I think
Yeah, she won't miss that much.
she won't.
Well, we could catch her up.
Okay.
After class, okay?
Yeah, I just wanted to let you know that she was on.
Thank you. Yeah, she said she was coming.
Yeah, she must have just gotten the time wrong.
Okay, so skin analysis and consultation chart. A lot of places that you work at will have their own. But if you're gonna be doing your own thing, it's great to have a copy like this given to you. And you can definitely just make photocopies of it or take some of our sentences that we used as an example to make your own skin analysis and consultation chart. You definitely wanna have them fill something like this out, as well as have a waiver. If you're going to be doing any kind of peels or anything active like that, you can find online a waiver, so that you are not, easily sued or something like somebody.
Would you do the waiver regardless, or just
This
only
is
the
really, you
certification?
have them sign a waiver and do a test patch really when you're gonna do something more like peels,
Active, yeah.
right?
Yeah.
If it's just a basic facial, not so much. If
Okay.
you're doing waxing, I think a waiver is a great idea because you wanna make sure on that waiver it asks them, are you using any acids? Are you using retin-A? Have you used anything for acne? Things like this, so that it holds you, harmless to the best of your abilities in case they, forget or omit some of that information, and then you have skin lifting or burning or a problem with the skin. By signing the waiver, at least you have something on your side should somebody say that you've done something wrong and come back to
In terms
complain.
of the waxing, if let's say they came in for like some kind of facial waxing,
Uh-huh.
and you saw some telangiectasia or something like that, and
Right.
would you still do that, or would you recommend that they get an okay from their doctor?
Are we talking about just like an active case of rosacea, or are we talking about
Just maybe
a few broken blood vessels?
either or?
So it depends case by case
Yeah.
on the client.
Yeah.
How bad is it? How sensitive does the skin look, When we're waxing, and are we talking about facial waxing or
Yeah.
body waxing?
Yeah.
Facial waxing, if the skin looks broken, or the barrier looks broken or compromised,
Yeah.
it would be best to say, hold on a second, I'd love to do this wax for you, but your skin, the barrier looks compromised, or it looks like you might have an active case of rosacea. And if I do this, it might cause more inflammation. It might make your rosacea act up. It might cause some hyperpigmentation because your skin is already inflamed. So we need to try to calm that first,
Okay.
and then we can come back and wax your skin.
Okay, so you wouldn't just
It-
have them sign a,
If somebody says, no, it's fine, I wax
Yeah.
all the time, you could say, depends on if you've worked with their skin before, right? If they're
Right.
brand new to
Exactly.
you and you've never worked with them, you're taking a risk by just figuring, okay, just sign here and I'll do it. If you've worked with their skin or done facials on their skin, you already know kind of how their skin reacts to things.
Exactly.
You know a little bit more about their history, you've developed a rapport with them, then you might feel more comfortable.
okay, yeah.
You know what I mean? So it is a case by case,
Right,
and then you
obviously,
also
yeah.
have the rules or the protocol of the place you're working at.
Sure.
What will they allow or not allow? So if you're renting, obviously you have more say over who you would do waxing to and who you wouldn't. That's why doing something like this is super important. Sometimes people forget to mention things, even if it's not on purpose, right? So, do some of you have this now? If you look, and you can show it to the others, it'll say like, what is your main skin concern? Because you also wanna know what their main skin
Right.
concern is also, regardless of your findings, right? Okay, and then you're gonna ask them, how often do you wash your face? What products do you use? Why is that important? Because you can kind of get an idea of what the skin is already used to and what they're putting it through. If somebody is used to a creamy cleanser, whether it's right or wrong for their skin, and then you're switching them over to a gel cleanser, they might say, oh, well, you know, my other one was creamy and more moisturizing. Why do I need this one? And this one foams up. So you have to be prepared because they're going to be used to using certain things, a lot of people. Or you're gonna find people that use everything. Well, I use this, or I look up TikTok and I buy this and I buy this, and they're all over the place with what they use.
This form, I do it before treatment, I do it.
Yes, so they come in, you can have like a clipboard, right, in your case, cause you're gonna have your own place, we know that. And you would have something like this set up,
Okay.
right, for them to fill out, okay? And you'll ask them to fill it out, and then you'll look over their answers with them.
With them, okay.
Right, and then you can write little notes down. Because if somebody says, well, I don't remember what moisturizer I use, or what cleanser I use, what was it, a cream? What is it, a gel? Did you buy it at the market? Did you buy it at a department store from an esthetician? And that'll kind of help you, it's kind of like investigating to clue in on what they're doing, because that affects their skin, very much so. And they might not have a balanced skin. They might not be on the right regimen. And it's part of your job to get them on the right regimen. So you need to know what their skin is being exposed to already. And then what products also that they're not willing to change. Or what products that they're using that are prescription.
Well, that's what I was gonna say about the prescription medications.
Yes.
I mean, obviously, we're not supposed to be experts in this. I mean, I know a lot of medical stuff, but
Right.
the thing is like, you know, you could have someone like on like a anticoagulant or something like that, and
Yes.
you wanna be really careful about.
Yes.
But the common person wouldn't know what that medication is for, so I assume you can say.
So it's very smart if you get yourself familiar with just a few of the common medications people are on,
Yeah,
you know?
And what is not
Like-
recommended to do, to combine with facial? I mean, there's
exactly.
something,
Yeah.
Right, like if you see on here, if you don't, oh, now she's handing it out. Okay,
Anybody not have one?
let's see if everybody has it. Do you have it?
Like if you have if someone's on a blood thinner or.
Right, like
Yeah.
if you look at number 11, are you taking vitamin supplements?
Yeah.
Right,
Okay.
so are you taking fish oils?
Fish
A lot of
oil
fish
thins
oils, that
your-
could thin the blood just a bit.
Yeah.
So if you're planning to do something such as waxing or microchanneling or something like that, that can affect something like that, you need to know that.
Right.
Sometimes we ask them, okay, well, if you have a heart monitor, I have a client, she has pacemaker.
peacemaker, I know, yeah.
So I don't do galvanic currency or treatment on her. Why? Because even though galvanic currency is a DC current, it still runs through the body. And
Exactly.
this can affect, you don't want anything that can affect a pacemaker, so that's a really important question. And the client that I had, interesting enough with the pacemaker, didn't mention it. I saw the scar,
Oh, wow.
right here, and you can kind of see it was a little bit lifted, and I said, oh, you've had a surgery. Oh, yes, I have a pacemaker.
Oh,
Okay, so it's on the questionnaire, so it's very smart, Maya, if you go kind of one by one with them, especially their first time, you're gonna save yourself and this client possible problems later.
Yeah.
Cause then you say, oh, you say, do you have a pacemaker? Oh, no, you're right, yes, I do.
because I mean,
Or
I'd say
no,
I
I
don't have
don't.
a heart problem now because, yeah, they
Right,
would say no.
exactly, I don't
Yeah.
have a heart problem, I have a pacemaker, okay, well, that's important for us
Yeah,
to know,
yeah.
right?
Yeah.
Okay, cause there's certain contraindications for certain medical conditions, okay? Are you diabetic? Their skin reacts different, their body reacts different,
Right.
right? The way that the blood flows through their body often is different with diabetics, so you want to know these things.
Yeah,
If
they-
anything comes up, then you know about it.
if
How
they
about this?
bleed,
Yes,
it's not
bleed.
stopping, right?
it's
Right?
harder to stop
Mm-hmm.
on people that are on blood thinners and some
Exactly.
diabetics, so you wanna be very careful, especially like with the waxing.
Well, and two, like this, like you were saying, certain supplements do thin your blood.
Yes.
And like things, anti-inflammatories,
Right.
that, you know, you're taking turmeric or something.
Right, and you might
Yeah.
ask them ahead of time, okay, well, are you able to, with doctor permission, to stop some of these a week or so before? Yes, I am. No, I'm not. Okay, well, are you able to check with the doctor before we do something more invasive that it's safe for you? Yes, I will. Can you bring that
Okay.
note with you by chance? Yes. Email it to me, text it to me, put it in their file.
Got it.
It's very smart if you have charting. You know, even if you're not in a medical setting, it is very smart for you and the client if you have notes and charting.
Yeah.
Because how can we remember every single person's skin condition or their medication or their concerns? And before they come in, you pull that chart and you kind of look over it. And I still do it to this day. right?
Really?
And
Paper.
absolutely.
It's important.
It doesn't have to be, it can be on your computer or a program, it can be paper, however you want to keep the information, right?
Yeah.
In mine, we have it paper, and I pull the chart, I have a chart on you, tells me everything. I write notes after I've done the facial of different things that I've mapped out and found before I go on to the next person, before I forget, so that I can remember, refresh my memory, and then it helps come back to you, right? Because there's no way to remember everything, so
We
that
also
helps.
have free regimen cards that you could give your client a copy of what you're recommending to them. And it would be smart also for you to keep a copy that tells you what you've used on them, what
Yes.
you've sold them.
So
you-
that's different than a intake.
Right,
But you can
right,
have a regimen
Right.
cards, and Ultralux can provide some of
right,
those.
that's what I'm saying, it's free of charge.
Which is great. If you look at something like, number 16, you would figure, well, is that important that they've ever had a facial? It is. Some might come in and say, I just had one last week, or I've never had one. You kind of explain to them more what's involved in the facial. Some people are a little bit more apprehensive if they've never had a facial. So they want a little bit more detail maybe ahead of time of, that this is what I recommended, this is what we're gonna do, so they feel a little bit more comfortable with what you're doing. Or they might say, yes, these are the facials I've done in the past, I didn't like this, or I did like this, and that helps you, and you can write your notes. So the time to take to ask them to come in a little bit early, before the scheduled facial is really important. You won't have to go over this every time, but definitely the first time, and usually I still ask, how's your skin, is there anything to report, anything different, any other concerns from the last time I saw you? And while I'm looking, I'm asking. But that means I need to remember what they've said when I go back to my room or wherever my desk is and write those notes down too, okay?
Very important.
So that's very, very important. And if you look at number 18, like it says, please list cosmetics and skincare products using now, that's important. Super important, what cosmetics are they using? Because sometimes I have to be the investigator and I need to look, well, why are they having this reaction? Why is their rosacea worse? Why are they breaking out? Let me go look up and see what they're using for makeup and foundation, and what's in it. Then I come back and I say, you know what, I noticed that the foundation you're using has mica and silica. These aren't good for people that have acne. They're like little small metal flakes and they clog the pore. And I usually have a list, and you can do your investigation of makeups that are appropriate for those skin types. You can print something like that out and have it ready for them, that information. Lets them know that you're knowledgeable and you're the wealth of information and that they can trust you. So if you print something like that out, different products that are safe for sensitive skin, that are great for dehydrated skin, we're talking about makeup, and maybe where they can get it. Like I tell a lot of my acne clients, okay, Ilia is a great product, super clean, it's at Sephora, I like it. I'd rather use that or this than the one that you're using. Okay, because otherwise you can be chasing a problem around and around, and if they're still doing some of these things, not just their skincare, but their makeup improper, you're gonna continue with the same problem with the skin, right? Okay, okay. Any questions on something like that? On the questions we have here, or is there a question that you think you should add or have any?
As someone who's not in their menstrual cycle anymore, I would probably ask if you,
If you still get your menstrual cycle, you
Yeah.
don't.
Yeah.
Why? Because when we no longer get our menstrual cycle, we don't have the same estrogen pumping through our body, unless you're on
Exactly.
the patch or different things, right? So what happens if we don't have that estrogen?
First of all, you lose collagen in your skin, and also you tend to get drier.
That's right, so we tend to kind of dry up, right? So as we get older, our skin does, even those of us with the oiliest skin, tends to dry up. A lot of people are upset, oh, I have oily skin, but as you get older, the good part is you'll have more oil production longer than those of us that started with a normal combination or dry skin, okay? Okay?
Would
So
you
those
do a
are-
different one for male intake, like?
So if you wanted to do a different one for male intake, you could, obviously omitting anything to do with female menstrual cycle and different things like that. Adding possibly how often do you shave, what do you use as a shaving cream, do you use any aftershave, those kind of things,
Exactly.
right?
Yeah, exactly.
Okay, so you could definitely change some of the questions or do two separate ones. Some people just add it to here, and obviously if it's a male, he sees that, and see how number 7 says females, you can say male, and they'll just skip it if it's not
Yeah.
pertain to them, okay? When you look at, the next page, it says skin analysis. Make sure that you have a really nice mirror, okay? Or some really strong glasses as well, and a light, right? You can get glasses by prescription or online or at the different shows, for something that's strong enough that you can really see the skin. It should be pretty strong to where if you look around the room and it's the glasses you don't see so straight, or at least a 5 or 10 times, depending upon how well your eyesight is, right? To do the basic skin analysis. You can do, first what I do is I look at their skin before I cleanse their skin, and then I look at it again after I cleanse, right? So after I do just like the first cleanse, everything's off the face, I can get a better read, but I also kind of feel and touch when they first come in. Does the skin feel oily? Does it feel dry? What am I feeling on the skin? As they're telling me their concerns, right? And then it's interesting, when you ask people, how would they describe their skin versus what you're seeing? Oftentimes they'll say, no, well, you know, I'm really oily, when in fact, they're truly not oily. It's something self-induced because their skin isn't balanced. So it's pumping out more oil to compensate, but they're not truly oily. So it's nice to kind of ask them what they see, along with what medications they're taking and things like that, okay? If you look at the following page, you know, the diet is important for people. The diet does affect our skin. Staying away from dairy can definitely help lower the mucus in the body. For some people, breakouts and things like that are correlated with the diet, or wheat, or gluten intolerance. Not for everybody, but for some people, it does. Like you'll see on number 11, it talks about different vitamin supplements they're taking. It also has a recommended for acne skin. You see that? Zinc, acidophilus, vitamin A, and how much they should take. These things can make a difference for people. When you're asking them if they get itchy or burning.
Back to that one,
Go ahead.
those are oral supplements.
Those
right?
are oral
Yeah, okay.
supplements, right? Definitely want to ask them, have you experienced any itching or burning when you've used any kind of products? Oh, yes, I did. Oh, what products were those? What was the reaction like? I had hives, I had itching, oh, a little bit of redness, and you want to make those notes down so that you know when you come to your Ultralux products, what products can or cannot be safe for them, or kind of gears you towards what you're gonna do, right? Because although Ultralux has sensitive skin and they have a line for acne skin, you can mix and match depending upon what you learn about your client. Okay, you don't have to just stay with the clear line for acne, you can pull some things from the sensitive and mix it with the acne line, depending upon the skin that you're dealing with, okay? And then when you ask them, do they give themselves facials at home? We know that the facials at home, it's different than the facials we give, but it helps us to get an idea of what they're doing. Are they over exfoliating at home? What products are they using at home, right? That's important, and I would ask them, like, you know, give me kind of a rundown of what you do at home now. And that kind of helps us to see what the skin has been used to. And then, of course, making a list of the cosmetics and the skincare products that they use at home, okay? If you look at the following page, you're gonna see this talks about the essential oil extracts. These are the extracts that we use in the Ultralux line, okay? And you're gonna see that we have them broken down. Does everybody have that? It says page 13 on it.
You don't have the
No.
part
Let's see, let me see if this one does.
Okay, Joyce has it.
Yeah.
Yeah.
Does everybody else have it? When you look at that, that shows you, which is a great little cheat sheet to
You
have.
don't have 13?
No.
Yeah, no, I do.
Just gonna use it. Okay, so those are the essential oils or extracts that we use in the different Ultralux products. You see how it says acne? We use the lavender, the tea tree oil, and the geranium is in the omega-3 complex. In the discoloration, we use the eucalyptus and the lemon. The refining is the cypress and lemon. Sensitive is things like chamomile, tangerine, bergamot. And you'll notice that some of the products will say like bergamot wash. That's because that's what's in there. But otherwise, you will find those essential oils, and they're there for a reason in the products. And often you've noticed when you smell some of the products, how great it smells, it's from that. And then you have a list, and you can share those with your client, of the description of what each one does. You see how the lemon, natural astringent, antiseptic, antibacterial, brightens the skin. So that makes sense of why it's in the discoloration line. So each one serves a purpose. Chamomile, we know, is very soothing and antiseptic, great for dry skin. Hi, does she need a chair?
Yeah.
Alright.
Let me give you a folder. Did you get the current folder?
And then we have things like frankincense, which is relaxing and uplifting. So each of these serves a purpose in the product. It's not just there for fragrance, okay?
I have a quick question.
Go ahead.
I bought the sensitive, what is it called, the toner?
Yes.
And it does have some oils in it, I believe.
I have to look at it to see.
So the reason I was asking about that is in terms of layering, you know, if you would use,
But no, that is the second step, is cleanser then toner.
but I'm saying.
But the essential oil isn't gonna block, if you're feeling like essential oils,
That's what I was
your
wondering.
other products are
Joyce,
sending.
That's what I was
there's
wondering.
no
Different,
air.
than a large molecule oil.
Can you tell them
like
to
the
turn on
BB oil or
the,
omega
So like if
air
you put hyaluronic
conditioner?
acid.
There's
after,
no
it's still
oxygen
fine.
here.
Okay.
Yes,
Cause I know
I
you have to
understand what
layer
you're saying.
Thank you.
waters and then,
Yes.
yeah.
Ote, mako
So,
ka mami.
even though you have those essential oils in there, that's
Ali, have you-
perfectly safe
how
for
about
The
the
now?
molecules
layer.
are small enough that
Yes,
it's not gonna impact.
good question. No, everything else will still be able to descend into the skin, such as your hyaluronic acid, right?
Thank you.
And your hyaluronic acid product is fine for everything from an acneic skin to add
Thank you.
hydration to the skin, but not oil, as well as your older dehydrated skin type. So the hyaluronic acid is fine for all of the different skin types. And the Ultralux hyaluronic acid is super clean.
The one
Very
you
minimal,
formulated.
yeah, because we estheticians also help to formulate it. It's great stuff. We also make the hyaluronic acid back bar, which has only hyaluronic acid, no preservatives. You can keep it in your little fridge, or it has about a 6-month shelf life, and you can use that for your treatments.
Is that a different formulation?
Yes, it doesn't have the same shelf life. It's not as stable on the shelf as the one that's retail that they can go home with. Okay, so we made it super clean without any fragrance at all in there, because people do microchanneling and different kinds of modalities with that.
I have to see which one I have.
So we have 2 different formulas.
If somebody's selling to you at home,
No, she's on.
Right here.
Yeah.
So I think
I
you,
could have
I'm not
got
sure
the-
if you're
I
the
think I got
retail
the-
or the back
I
bar.
feel like I got the retail, but
Okay, but the back bar just doesn't have as, it's not as stable for as long, but think
Yeah.
about it when you're doing facials, you go through it much faster
Oh, yeah.
than somebody else would use that at home, right?
Yeah.
But that's like one of your little secret weapons that you can have in your back bar that they don't necessarily have at home,
Yeah.
that you can use in the facial. It's a wonderful hyaluronic acid and it descends great.
So are there any other, I know like you have some that are professional products.
Right.
Are there differences between some of them?
Mostly the peels are professional.
Yes.
And something like the hyaluronic acid there's a professional one. Is
Okay.
there anything else professional, Joyce, that I'm leaving
No,
out?
it's basically the peels. and-
Otherwise, they're formulated the
Yes,
same?
Yes.
this is the only one with the different formulation,
Okay.
okay?
Right.
Yeah.
All
So
the
that's a unique
formulations are the
product,
same.
Okay.
And I
except
definitely
the
recommend you guys to have that
Okay,
in your
great.
back bar, because most lines don't have something like that, and that clean.
It's very important, though, you tell your clients, and you know, that it needs to be applied to a moist
Right.
face. Otherwise, it'll work just the
That's what I
opposite,
was
it'll
asking
dry
about
you.
Right.
yeah.
the toner.
Right, because the hyaluronic holds 1,000 times its
Holds.
weight in water, but it draws
Yeah.
what, the water and moisture
From the
to
air,
it.
yeah.
So a lot of people put hyaluronic acid on it and think, well, that's it, I'm good to go.
Right.
And then they don't put a moisturizer, and they say, what you sold me, my skin is dried out more now than ever.
Right.
Oh, did you put moisturizer? I did not. Well, you need that moisturizer, it's gonna draw that moisturizer to it, and then the skin's gonna feel great.
Yeah.
Okay, so even if they have an acneic skin, you still wanna put a moisturizer with it, not oil, moisture. Moisture is different than oil. A lot
Not
of people-
oil.
I have a
Oh my
question.
God.
Go ahead, sure.
Can we put the toner and then hyaluronic acid and
Yes,
moisturizer, right?
yes, so you can put the toner while it's still damp, then you put your hyaluronic acid.
Right.
And they can kind of pat it in like this, right,
Yeah.
or they can rub it in.
Well, that's why I was asking about the layering, because you don't wanna put something oily that's gonna block
Right.
a water soluble.
Right, so you're
Yeah.
good with the cleanser,
Yeah.
then your toner, right, because those are just the essential oils, they're small molecule, you're good. Then you can put your hyaluronic acid, and then your different layers.
Like when you put the vitamin C after.
Then it can be a vitamin C serum, if
Yeah.
they're going to do that, you know, the layering is the way to go.
Exactly.
I
People
love
might say
layering.
like, why so many layers? Well, that's how we get all those nice actives in the skin, and we usually go from thin to thick, right? And that's, you know, there's no product that's just a one and done. A lot of times if you have something like that, it'll cancel each other out for the active ingredients, so you want to layer. Now, for some people, you might wanna add the products slowly to the regimen.
Right.
If you send somebody home with 8 different at-home Ultralux products, they
Gonna
might,
get
oh, what do I do?
Yeah.
Of course, you're gonna write it down for them to order, but that might seem too much, especially you're young and you're elderly and you're males. Usually for my men, my elderly or my teens, I try to start with a few and I see how the skin's doing, and then I can add more, then they feel comfortable because they're already accustomed to using certain products. Okay, you'll just add this between number 3 and 4.
Yeah.
A little trick actually for some clients, I will take Ultralux products and I'll write on the bottom, number 1, number 2.
Oh, yeah,
And for some
Makes
people, that
sense.
just makes it so much easier, right?
Right.
And they can say, oh, that's number 1, okay, that's number 2. And then you might have to change that if you add something.
Where does the liposome, the seaweed liposome come
So
in?
the seaweed liposome gel is a carrier product. You might use that twice a day or you might use that once a day. If you're gonna use it once a day, not everybody's using a hyaluronic acid, okay? Keep that in mind. They can use the seaweed liposome gel to help drive and carry the other products into the underlying tissue. So it has vitamins and nutrients for the skin, but it's also a carrier to help make your products time released and draw them into the underlying tissue. Okay, so
so it's a
cleanser.
base, it's number 2 or
Cleanser
number
and
1?
toner comes first.
Yeah, and then
Okay,
that.
we're gonna cleanse the skin, then we're going to balance the skin with our toner, and then we're gonna choose our products. If we're gonna use the liposome gel, has everybody felt this? It's important if you haven't, pass it around. That is from the clear line, which is more like the acne or oily line, but we have it for every skin type, okay?
So would you use that before both water soluble and oil?
Yes,
Okay.
right,
Yeah.
then you can go with this one next. Now again, if somebody's not using hyaluronic, so you can use this, then you can use your vitamin C, your different serums, the thinner.
So this doesn't
to
help
thicker.
push the hyaluronic acid any deeper?
Yes, if you wanted to use cleanser, toner, something like this, and then hyaluronic,
Okay.
you can.
Okay.
Helps to descend and helps to make things so they're time released, so the skin gets some all throughout the day. It's great. It's a great product to have.
It's vitamins for your skin.
Yeah.
Feel it, it's,
Yeah, I was just wondering in what order.
Yeah.
this
Vitamin
is a
vitamins.
carrier product to help drive your hyaluronic acid, and their vitamins are in that product. If you feel it, it's thin,
Yeah.
very thin. Doesn't feel heavy.
Yeah,
Oh,
it
you like
smells
the
good.
fragrance?
I love it.
Yeah, and that one is for the clear line, right? So that's gonna have
Yeah.
some of like the lavender or the tea tree oil
okay.
to help kill bacteria.
Now it's recording.
But we make it for every single skin type.
This would be for oilies?
That's an oily or acneic skin, the sample that you're touching there, yeah. How does it feel?
I have it right
And it's not sticky,
No,
and you just use a thin amount.
What is this supposed to do? Sorry, I stepped
It's
outside.
okay. This is a driver product, so not only does it help to nourish the skin with its own vitamins and minerals, but it helps to drive your other products into the skin, helps them to descend.
This is a toner?
No, this is a driver, or a product that helps to make your products time release, it helps them to descend into the skin.
Oh,
That's
to
what it was, a time
absorb
release,
more,
yeah.
right?
Yes,
What's it
better
called?
absorption, right? Because if everything's sitting on the epidermis,
seaweed
what is it
liposome.
doing, right? We
What's it
really
called?
want to get it
Seaweed
to
liposome.
absorb.
Seaweed liposome.
It's a
Ooh,
liposome
pass
gel,
it
let
over
her,
to you.
yeah, and then you can
Oh.
feel it. And you feel it's thin,
Yeah.
it's great stuff. So something like this should definitely be part of their home care as well as your back bar.
Yeah.
So
So I think
there's-
you had me buy that because I got the, I forget the number 9. Is it
Yes, the number
peptide?
9,
The peptides, I think.
for the anti-aging with the peptides and the microvenom in it.
Yeah.
And you're using that, right?
When I, yeah, remember to.
When you gotta remember or it doesn't work,
Well,
right?
I kind of cycle all my products, I have
Yeah.
so many, so.
Yes, and you can use,
Yeah.
and the thing with products is whatever line you choose, and we hope it be Ultralux, is that
All the time.
they tend to work better when you use most of the same line.
Exactly.
They're
yeah.
made for a synergy to work together,
Exactly.
right?
So would
So,
you use after or before it?
before what?
All the skincare products?
This is a before, it's a cleanser, toner, and then this type of product. But you really want, like, Ultralux is an amazing product line, you want to use most of your products from the Ultralux line. Why? They're made to layer together. And they just have a synergy when they're created by our chemists to work best together. Rather than one from this and one from this and one from this, right? Also helps the client at home too, okay? Okay, did anybody have any questions regarding the essential oils?
I'm sorry.
Okay,
Yeah.
so everybody has that, right?
Private?
If you look at this page, it says normal skin. Okay, and on the back, it'll say diagnosis and treatment, and on the front, it'll just, we have a definition. Normal skin is a well-balanced skin. Okay, normal skin is what? A well-balanced skin.
Oh, wait,
Doesn't mean it can't, oh,
which
wait.
one?
Normal.
Normal?
We're on normal.
Normal?
We're on normal.
Okay.
Well balanced.
Who here believes they have normal skin? Okay, we'll see, okay. So normal skin has few imperfections and generally a smaller pore, okay? So you can have a few imperfections, it doesn't mean your skin is perfect, it doesn't mean you have not one blemish or nothing, and the skin is like dull or glass, but it just means that the skin isn't too oily, it isn't too dry, not too much flaking, not too much shine,
Maybe a
okay?
combination.
So that's different, that would be a combination,
I'm combination.
right? So we'll see, because a normal skin really is the same throughout, right? And if you look at the back, it says here, a balanced complexion with few imperfections, not too oily, like I said, or not too dry. What is a treatment? Maintain skin health with basic skin care routine, a cleanser, a moisturizer, and a sunscreen. That's the minimum.
Yeah,
Cleanser, moisturizer,
and this is what
sunscreen.
usually people use. They
But
don't,
you're there to educate and to show them, well, if you add different serums to the skin, you can achieve an even better skin. We wanna get your skin in the best condition that your skin can be in.
Right, especially if someone complains and says, hey, I've got this going on.
Right.
Then you can say, oh,
Right.
you know, what would be helpful is to add blah, blah, blah.
Right, well, what do
know.
you do, Karen, if they say, well, I don't have anything going on, I mean, my skin is fine, I don't know.
Just say, that's great, and I'm really happy. Just know that in the future, your skin evolves and changes as you mature. So it's always good to do kind of, you know, prophylactic approach of,
That's right,
you know, everyone should use vitamin C.
that's
Everyone-
right.
Because
Even if they have a normal skin and no
Yeah.
real issues going on,
everyone should use
we can
sunscreen,
still
yeah.
improve your skin and we can slow down the aging process
Mhm.
by using certain products.
so this is how you answer her?
Yes.
Yeah,
Right, because there are gonna be clients that you look
Yeah.
at and they do have a normal skin and they still, my skin is fine, I just
Yeah, I
do
don't,
facial once a year or I don't
That's
do
it.
anything.
I mean, you do evolve, I mean, now that I'm in my mature years, you know,
Right.
I mean, it definitely makes a difference. I mean,
Yes,
I had different skin when I was in my thirties.
Mine
that's
too.
right.
Yeah.
And they might
you
be using
change.
products from 20 years ago.
Exactly.
You'll find clients that are coming in that maybe now have a more normal to skin as when they were younger, maybe they had more oily skin, and as we mature, we have less estrogen, we have less oil production, now we're gearing towards normal. Well, those skincare products were fine years ago, but your skin is a little
It evolves and it
different now, it
changes,
evolves
yeah.
and it changes as we get older and medications we're taking. So let's take your skincare regimen to the next level, and let's match your skincare to your skin type now. There will be, what do you got there?
I don't know,
The
vitamin
regimen
C.
card?
Yeah.
Yeah, and then you can kind of fill it out and mark it
For
for
example,
them
vitamin C is a
there.
really
Right.
good thing
Okay.
for everybody.
There are
to use.
people that are maybe going to be afraid to change. They've been using the same
Exactly.
thing for 20, 30 years. People come in, oh, well, I had oily skin or I had acneic skin, and they're still using foaming cleansers. And they have dry skin. We want to go more with something like a soya wash or a non-foaming cleanser for a dry, dehydrated, or an aging skin. And they're, oh, well, aren't I gonna break out? Well, no, your skin has changed over the years. It doesn't stay the same.
Mhm.
You're not gonna break out like you did, and they're so afraid that that's gonna happen again, that they're
Yeah.
resistant to change, and you kinda have to veer them towards something a little
So
different.
you recommend to give them some samples or? Because
Okay, that's a
they,
good question.
because they said, I don't wanna invest now $500.
I'll tell you what is a good idea. You know, there are people that will, from the get-go, have a facial with you, love it, and say, okay, I like the products, I'm absolutely willing to try them at home. Then you'll have others that are a little bit more hesitant, I don't know if I wanna spend that right away. But we wanna get them on the Ultralux products, we want, because the home care is equally, if not more important than the facials, right?
Exactly.
You're doing the
Yeah,
facials,
for sure.
even if you're doing it once a month, twice a month, but if they're not doing the proper at-home care, you're not gonna get the same results with your Ultralux facials as you will if they're using the corresponding skincare at home. They need to understand their part is equally as important as your part.
Okay.
If you have a client, Maya, who says, I don't know, you know, maybe, and this is very common, I'll take one product or maybe two,
Exactly.
that's right. Okay, we've all done that
Exactly.
ourselves too, we don't necessarily wanna buy 10 from the get-go. Okay, so you're gonna pick out the two top or one top
Mhm.
that you think is most important for them.
Yes, yeah.
And then you can Ultralux has little samples that you can either sell to them, you purchase from us, or you can give to them. You can add to the price of your facials a little bit extra to compensate for the fact that you know you might have to give some of these little samples. When you purchase from us a certain amount, you will get certain samples come free with it. Save that for that. Or you can be smart and purchase some samples on the side, especially like the sunscreen, very good idea to purchase a bunch of those samples, and the vitamin C serum, the hyaluronic serum, these specialty items, and give it to them with their facial. And say, okay, use this, and even one or two, when I see you next month, let's go over it, let's see how you liked it. And you can also text them or check in between. And then if they liked it, the chances are they'll purchase it
They'll
next time.
I mean, I was gonna say, the one thing is that certain samples, like I'll say, for example, a
Yes.
vitamin C sample, you're
Right.
not gonna see something overnight.
Exactly.
No, you're not.
And so.
But what we're looking for is,
It's an investment.
did it irritate your skin? No. How did it feel on your skin? Good,
Right.
but I didn't see any results.
And
No.
you're not going to.
Not yet. It takes
Takes a while.
time. Things have to be used repetitively.
I mean,
To keep our
years,
skin in the best
years,
condition, no
yes.
matter what skin type,
Exactly.
we need to be consistent,
Right.
right? So as long
Yes.
as they said, okay, well, it felt good or it didn't bother me, great, then let's put that in your regimen and we will be getting you your skin in better shape and to the best skin you can possibly have.
Okay.
If someone has an allergic, you sell something to someone and they have an allergic reaction, if they return it to you within 30 days, you'll have to return it to us, and there is the
A
shipping
restock.
charge for us to get it back and so on and so forth. But within 30 days,
Are we exchanging within 30 days? Is that how we're doing it?
we'll guarantee the product, okay?
Okay.
So
Exchange or refund
Is
choice?
we'll exchange.
Is that if they
And
don't
it,
like
and it's
it?
very important.
No,
not
allergic
if they didn't like
reaction.
it, I
If
had a
there's an allergic
reaction.
reaction,
Or,
does
you
that
know-
mean it expired?
No,
No.
not necessarily. Allergic reaction is their body's reaction to an ingredient in the product.
Yeah,
Yeah.
and,
Different than
and
expiration.
it's important with the products that, most of them, other than like cleansers, you're not gonna see a difference, like you said, if you use it for a week.
That's right.
Okay,
No,
well,
and you
even like something
mentioned the
like
Ultralux
sunscreen.
9, Karen,
Yeah, yeah,
you need to use that religiously,
okay.
and not just, oh, I'm going out tonight.
Yeah.
Okay, but
Yeah.
religiously, and you will
Right.
see a difference
Yeah.
with the
Michelle?
products, but
Oh.
like anything, you have to, you don't go to the gym one day and work out
Right,
for a
and see
week and
results.
say,
Exactly.
look at my muscle,
Uh,
right?
Right,
Yeah.
and it's your job to educate them.
Well, I think that's the thing with sunscreen, people, when you're younger, you're like, yeah, it's not a big deal,
It's not a big deal.
but
no.
it's the cumulative,
I tell my young people with the
Yeah.
sunscreen, I know you don't see brown spots right now. Do you have any red spots or any pimples? Oh, yeah, I have a red spot left. Well, if you don't use the sunscreen, that spot can take years because of the post-inflammatory pigmentation, years.
Mhm.
But if you use sunscreen religiously, it'll go much faster. Oh, so I try and find something that
Right.
equates to their time in life that makes sense for them as to why they need that
Mhm.
product now, right? As we
Yeah.
get older, then we say, yeah, you see you have the pigmentation or you have
I mean, just show them pictures,
melasma.
this person used.
And then they understand,
Yeah.
okay, we better do something now.
Yeah.
Because although it's there now, it can get worse.
Absolutely.
And
Okay.
sunscreen is so
So
important.
this is
Oh,
the
absolutely.
sunscreen.
In my
Yes.
time,
That's what
you used to go out in the sun, you put baby
Slight-
oil on,
Yeah.
Yeah.
Fry.
By the way.
and I ended up
Everybody touch the
with
sunscreen.
melanoma.
This
Clark
sunscreen is one of our
level
best
4.
products that we have.
Oh,
Men love it
On
too
my back,
because
I
the
have
face
a
is not shiny.
huge scar.
This is the chemical one though, right?
Yes,
And
we
it
also
was
have pure
from
minerals too.
years of
Which,
teens,
or the
my
physical,
teens
which have the
baking.
different colors in it.
So,
And even the light
sunscreen
one
is
on a
so
man,
important.
and if he's
Yeah.
fair skinned, he won't see any color, that's fine.
Yeah.
But this sunscreen in particular is great with makeup, yes.
I just have a question about
Sure.
the allergy, because I use the neck and decollete cream.
Uh-huh.
I just have an itchiness and redness. It means I have allergy to that?
So you put on the neck and décolleté cream and you felt itchy, you put it on just once,
Once, twice.
and
but
still
it's
the neck,
just-
so there can be something, it doesn't mean a true allergy, that's irritating for your
Irritation.
skin. Or in the neck and décolleté cream, we have the microvenom technology, so you have a lot of active ingredients in there for firming and toning the skin. If you have a sensitive skin, you might have to just use it every once in a while, or mix it with a little moisturizer. If it's really itchy and red, then it's not a product for you, it doesn't mean it's a
Right.
true
Which is
allergy.
fine.
Put like moisturizer before.
You
and
can do
after.
that in your
Okay.
case to kind of train the skin to get used to it, because when you use things, just like when you use an
How do
acid,
you know? What
doesn't
did you
necessarily
watch?
mean you have a true allergy, is maybe your skin is a
Who
little
can
bit more
say-
sensitive.
Right.
It takes a little bit of time to get used to it.
Right.
Because
Who
that
can
neck
see
and
that?
decolletage cream they have is amazing stuff for
So they
forming.
have to protect here. because,
Yes,
yeah.
and it has a sunscreen in it as well. The Ultralux
Right.
neck and decolletage cream
No,
has a
but if
sunscreen,
it says
so it's
no.
fabulous for this sensitive skin
Right.
area. But if you're having a reaction, start a little slower, use a little less, put a moisturizer, then maybe put that over it and slow. If it continues to happen, then I would say, yeah, then don't use it. But I don't hear that too much with that product, doesn't mean it wouldn't be your
Right, but
case.
I buy another one from Costco, they have like yellow box.
Uh-huh.
Those is fine, maybe they doesn't have a good ingredient.
It may not be as high quality and as
Right.
active
It could be an
ingredients,
ingredient
right?
that's
And
just
so
related
your skin isn't as sensitive to it.
Sorry, was that the SPF product she was
Don't be
saying
sorry.
that,
Like I put some, I have a
that
body.
caused the redness?
No, that's a
No.
neck and
No.
decolletage
Oh,
cream,
okay.
not the SPF.
What is this one called, the one we just tried?
Microvenom face and body, it's under sun products on your price list.
So that microvenom has that
It's the
microvenom
very first
technology
one,
to firm up the
microvenom
skin as
SPF
well.
30 face and
Oh,
body.
and it's anti-aging, yeah, and it's fine, we did
You
a
see
facial
it?
on you, right?
Yeah.
How was the skin?
It's good right now. I'm breaking out.
Okay, but after the facial, it
It was good.
didn't
It
bother
was
you?
glowing. My dermatologist said it looked nice.
He did?
Yeah.
He or she did? Oh, what a compliment, right?
Yeah.
I just had these cards passed out to you.
Yes.
These are a regimen card.
That's a regimen card. I don't have
And
one
it
in my
tells
hand, but I
you
do.
the order of how you use things as well. It'll show you wash, scrub, toner, serum, oil, treatment, hydration,
And again, that's
eyes,
safe for
SPF.
teens,
Not all.
that's safe for younger people.
Right.
You know what's nice about this product here? This sunscreen is if you have any kind of breakouts on the body, this is great for a sunscreen, so you don't cause more breakouts on the chest and the back. That's a big deal. When we have breakouts there, we don't want to use anything that's gonna cause more breakouts, and that doesn't. And it's only essential oils, no synthetic fragrance, and no white cast. Yes.
Should an SPF be a little higher than 30?
You know, when it comes to SPF, whether you apply a 30 or a 50 or 100, that doesn't mean you can stay out in the sun 100 times longer and 30 times longer. All of the sunscreens, after about 2 hours out in the sun, needs to be reapplied. So a 30 is just
I was
fine.
just explaining like the difference between physical and chemical sunscreen.
Right, so there's physical that puts an automatic block, and then there's the chemical where your skin needs to kind of absorb it
Yeah, like this
and
one's
throw the
absorbing.
rays back out, so it takes about 20 minutes for your
The
sunscreen to
physical
be
ones
active.
stay
Oh, really?
longer on your skin.
Right.
Yeah.
Yes.
Yeah.
But even if you use like a pure zinc stick, which is white, you still don't go 10 hours outside
No,
on the
you have to
beach without
reapply.
reapplying.
Yeah.
They have to
But it lasts
reapply.
longer than that.
Right.
Yeah.
And that's where maybe your little, we even sell for your clients a small travel size.
Oh, really?
Yeah, this is a wonderful thing to have on your shelf,
2
because you say,
ounce.
put it
It does.
Oh,
in your bag.
good.
Didn't know
Put
that.
it in your bag. Yeah, we have a 2 ounce, and that's great. Yes.
Do you have a toner, hydrating toner that I could try?
So the toner that I have up here with me is the maintenance. This is for
I'm
any
using
skin
it.
type.
It's in my face
The
now.
nice, yeah.
sensitive skin one. Joyce, we have one back there. What is that one? See on the shelf? I have another toner there.
Oh,
And
that's
ours
nice.
also has
Thank
the
you.
sea salts in it to kill bacteria.
I think that's the one I got.
That's the maintenance. That's for the
Oh,
general.
no, I got the sensitive.
You guys might also have in your packets some of the
This
products.
maintenance.
That's maintenance too. Did
Yeah.
you get a little booklet of just the products in there?
Yeah.
It's just
So
the
you'll have
different,
that.
remember, essential oils, that's the only difference. And that is what you do wanna use,
Oh, that's the only difference
Yeah.
in the different.
Right.
clear,
Uh-huh.
maintenance,
Oh,
sensitive.
Clear is for acne, normal is for
Oh,
normal
that's a
skin
clear.
type.
So the main
That's
ingredient in
the
all of them is gonna be.
And what you do
It's
wanna
gonna be
use,
water.
remember, that's the item you wanna use with your hyaluronic acid. Before you put on your hyaluronic acid, spray that.
That's right.
So for all of the toners that you have, the
They
first
all will
ingredient is
have water in them,
They're all the
yes,
same thing,
yes,
except
absolutely,
different essential oils.
absolutely. And you'll find in the normal line like grapefruit, cardamom, frankincense, rosewood, geranium, those type of things. And we're still on the basically the normal skin, and it's okay, we can veer off, but then I'll just make sure I go over these things, okay? And as it says here, occasional exfoliation can help. So when you have a normal skin, you don't want them exfoliating every night at home. Because they're gonna take their nice normal skin and they're gonna cause a problem with their barrier and disrupt it and maybe make their skin sensitive or irritated, where they normally wouldn't have that problem.
I can
Karen, I
stand.
will never
Okay.
learn everything. I'm not, no,
Oh, this has a rose.
I like the geranium.
Yeah,
Smells
that's
good,
and the
huh?
geranium, yeah.
It does.
I
And you
love
can
it.
spray it on
I'm
your
just surprised
face or
that
anywhere
many
else, yeah.
green.
And again, it's by skin type we have,
We
but
can
that's
see it on
just
our
the
face.
maintenance. Sure, absolutely,
Yeah.
no problem.
The travel size.
That's our
Yes.
sample.
Oh,
so no
you're not
problem.
spraying, girl.
It's hard to do my hair.
It's really like.
That's just my back part, so if it doesn't spray
I
out
think
well,
it's
it's
okay.
because of,
Yeah.
I have,
You have any idea of sample?
does spray out well?
It's a toner.
I'm
Good
really
stuff,
impressed
right?
by the,
Good.
well,
It's
I'm
good.
really impressed by the sunscreen, it's beautiful.
Isn't that beautiful? Yeah, did we have that at the class? But
I
maybe
was-
you didn't notice.
I
it.
wasn't there for
And
the
then-
second,
Oh,
and
okay,
for the
you
facial.
so
You're the model.
So that sunscreen is
Let's see
wonderful,
what
because if you put makeup over it, it doesn't ball up. You know where some makeups you put over sunscreen and it kind of smears and your makeup doesn't
Which
sit
is
well?
that?
You
Yeah.
put makeup over that sunscreen and the darker your skin, sinks right in, no white cast.
It's nice.
Anyone
that's
who
nice
tries our sunscreen
I
is
have.
sold forever. I mean, everyone loves it, loves
Right?
it, loves it.
I have a sensitive skin, but when I do it, I'm not gonna burn in the beach.
What do you mean?
After this sunscreen.
Right, no,
Yeah,
but
I'm
you
not
gotta
burning.
make sure that you
She said she's not
reapply.
burning.
It's
Perfect.
effective, yeah.
Good.
That's really.
Yeah, and it feels kind of hydrating, right? And
Yeah.
it feels almost like a light moisturizer
Yeah.
rather than
It's
sunscreen.
nice, yeah.
Where some sunscreens, you feel like something heavy on your skin, you wanna
Right.
take it off.
Yeah.
This, I don't feel like that at all.
And when you run across that male who says, I'm not using any product,
Right.
the sunscreen is
That's what
also
you
for
can get,
sunscreen.
that male
Right?
client, that normal skin, that combination skin, the
This
sunscreen
is the tone.
for the men. All the men should go
This
home
is
with that.
matte.
Even, and especially your teenagers.
Stays.
The younger they start, the happier they'll be.
Like I have different ones.
The clients that I have that have been following the regimen for 30 years, they do look different than those that have just
Yeah,
started.
that's why when she was saying.
They do.
we were just, I'm like,
And you'll
oh my
notice that over time, their skin just looks younger, and it's aged slower, and they're doing their home care twice a day.
And do you love the SPF
I do
powder?
too, actually.
They can use it after?
They can, you're talking about like the different mineral powders on top, sure.
Yeah, I've got it.
That adds a nice little layer of protection, and some of them have color in it too, to
Right.
kind of blur any imperfections on the skin, yes.
But do you guys have, those, the sample to try?
Which one?
Well, like the,
The minerals?
yeah. like
Yes,
the
Joyce can bring
medium.
up some of those colors to let you guys
We have
see
light,
those colors,
medium,
light,
and
medium,
tan.
and dark. If everybody wants to
Probably
feel
medium.
those, she wants to feel those.
I'll bring it
Yeah,
up.
she'll
Finish
bring them
the
up.
exam first.
Okay.
Yeah.
It's like,
It's choking
And
me.
it's
It's shocking.
I wanna
so about the
finish
same
this.
as.
That's right.
And then do
Does
that.
it have similar ingredients to the microvenom?
Well, it doesn't have the microvenom
Yeah.
technology for the firming and toning and anti-aging,
Oh.
and it's a mineral sunscreen, so it's an automatic
Yes, it
block
is a class as
for the skin.
Also, it's gonna be more
it's an
whitening.
Anna.
A little bit
That's
more,
why
but
it's
not as much as you're
LD.
expecting, actually. When you kind of emulsify it and rub it through your fingers and you put it on, you'll be surprised
She's
at what
afraid
a
of
nice
science.
colorant
She's in
and
the
how
same
well it blends. She'll
place.
bring
It's a
one up.
foundation
Yeah. Light,
form.
Yeah.
you know?
But you could
And
also
then you just have to
use
get
the
a professional
microvem,
account.
the face and body SPF 30 underneath if you
They're
prefer.
pretty good.
That's right,
You use,
that's right,
because this is like a foundation.
right.
You would use it
Absolutely.
in lieu of your foundation.
Right, but I have some people that prefer a mineral, and I can put a light one on, even a gentleman, it rubs right in, it doesn't look like anything.
Yeah.
Okay? Your teens will like the mineral too, because it kind of blurs a little bit of the imperfections and doesn't aggravate the acne or clog the
Is-
pore.
There's the,
The mineral we're talking
mineral
about.
one, is it tinted as well, or?
Yes, light, medium, and dark, she'll bring
I'm
up
gonna
one of
bring
each,
samples so you
and then
can
you
try.
can, you guys
Oh,
will be able
nice.
to touch it and feel
Oh,
it,
good,
okay?
yeah.
Okay, the next is a combination skin. Who thinks they have a combination
I actually
skin?
think I do.
You can't raise for each one, no,
I
your
did not,
combination.
okay, well, it's hard because with the mature skin too, it's like everybody.
That's right.
Yeah.
Right.
Christine,
Yes.
have them come up and show them.
I'm going to, after I
Okay.
go through some
Oh,
of this,
after,
then
okay.
we're gonna go through people's skin and let's see what we got. and
Yeah,
what we-
who
Sensitive?
thinks they're
Okay?
combination, who thinks they're dry, who
Yes.
thinks
And
they're
I don't
oily.
That's why I'm getting
combination.
kind of a poll, because
Okay.
I wanna see who was right and who was
Right,
wrong.
okay, good,
Of what they
good.
thought their
And
skin
also,
was, right?
how you can have different parts of your face.
That's right.
Some
So the
dry, some
combination
oily.
skin is a little bit dry, a little bit
A bit
oily.
oily.
Doesn't mean that the dry has to be severely flaking, it can just be slightly dry on the cheeks and a little bit more oily like the T-zone, right?
I have a question,
Sure.
sorry, as the
You
mature,
don't
as-
need to be sorry.
as the mature person here. Because I was reading too, like as you mature, obviously you have more androgen, you have less estrogen.
That's
So
right.
your pores are more visible
Yes,
as you
for
get
some
older.
people, yes.
So does that change if you're combination normal? Does that,
The
does your
pore
skin
size can still look a
become,
little bit different
does the
as we
skin
get older.
become combination rather than?
The
something
skin,
else?
if you're combination, oh, you mean going from a
Let's say I
dry,
was normal,
Uh-huh.
but now I'm, you know, I don't have
most
those
likely going
hormones.
from a normal to a combination won't happen as much because the combination has more oil production.
Uh-huh,
But I can see a combination going to a dry or a combination going to a
because
dehydrated.
it's hard to tell with the pore size, you know,
Yes.
because of the hormones.
That's right.
Yeah.
Right, and if somebody's taking the patch hormone,
Yeah.
that affects it too. But we
Absolutely.
are
really?
working with
Yeah.
what's
So
in
it
front of us,
counteracts it, yeah.
right? So if they're taking a hormonal patch,
Yeah.
Yeah.
their skin often will look a little bit more youthful because they have more estrogen.
Right.
So we're working with what's in front of us. So they're a
Yeah.
little different than a client who's menopausal who's not on any
What about
hormone
like someone
replacement.
like she's taking cohosh, like the black cohosh?
Some people, it helps, and others it doesn't
Yeah.
with the cohosh. Everybody's a little bit different, but it's not the same as taking, you know,
It's a plant
the
estrogen,
bioidentical
yeah.
hormones.
Can I
or
ask what collash is?
Oh, it's a black, or it's a plant.
It's a plant-based and it can help people
It
that are
helps
going
with
perimenopause.
It's a
and
plant hormone.
Can one person explain to me? I'm sorry.
Go ahead, Rose.
It's
No,
a-
I would prefer if you.
Okay, so this black cohosh is something you can buy over the counter that helps with hot flashes for some people and the symptoms and signs of like perimenopause. Perimenopause is when you're going through.
Perimenopause, yeah.
Right, when you're
perimenopause.
going through the symptoms, right? Once you've already had the menopause and there's no longer a period, what we consider for a 1 year of no period, you'll have a lot less of those symptoms.
Yeah, it's a plant hormone rather
Yeah.
than a
Then a
animal.
synthetic
Animal
animal
hormone.
bioidentical hormone.
Yeah.
And
The
so that's-
side effects of it, you growing hair from suddenly from here, hair,
Were
from
you?
here, boom,
Were you?
hair, yeah,
Did
So
you-
for some
is it
people,
oral?
yes, for some people, no.
Is it oral? Is it?
Yeah, it's
Yeah,
oral.
for some people, these kind of things, also with the patch, how it affects their skin and growing hair, not growing hair.
But you don't need it, you're young, what do you need
So
it?
this is
I just
not
wanted
good.
to know what it was.
Oh,
no,
it's just
no,
a supplement
yeah, it's
for,
Yeah, so
yeah.
it's a,
for hot
there's a
flashes.
different
It's a hormone
supplements.
replacement therapy.
So you'll notice with this to
Which will
manage,
get-
you know,
I recommended it to
You
my
guys-
sister.
and how did it go?
And it helped her a lot.
It helps a
Yeah.
lot,
Same?
It helped a
Saves
lot,
me.
because she was getting hot flashes like constantly.
it saves me.
And
That's
somebody
right.
had mentioned it to me, I don't know. who.
See, so that's why it's important that you know what they're on. If you look at the combination skin, you'll see that, what are you trying to do? You're trying to balance their skin
Yeah.
the best that you can, right?
Mhm.
The balanced skin is the skin that ages slower. The balanced skin doesn't break out as much. So you kind of wanna help to hydrate the skin. And they can even use different products in the different areas if you wanted to.
Wow.
So in essence, you're trying to make this type of skin more normal.
Or balanced. You'll never
Balanced.
make it normal, but essentially
You're-
balanced, right?
Okay.
The balanced skin is the healthiest skin we can have, right? So we wanted to try to balance the skin out. I have some clients who say, well, I use the BB oil or like this, feel this, the omega oil on my cheeks where I'm dry,
Yeah.
but I just avoid the T-zone. Perfect,
Right.
Really, it's good?
perfect, you can do
Yeah.
that,
That's why I
right.
use salicylic acid just on my.
So it's very good to have a woods lamp. Everybody knows what that is, or from school. So the woods lamp, you write this down, you wanna purchase one for yourself if you're working on your own, okay? Lets you see into the underlying tissue,
Mhm.
and on the woods lamp, it'll have different colors that correlate with what you're seeing. And it lets you see down past the epidermis of how much oil is produced, how, is the skin dehydrated, how deep the pigment goes. With hyperpigmentation or melasma, some of it can be more epidermal and surface, easier to treat. Some of it can be more dermis. And on your woods lamp, by looking, and I always do that, I turn the lights off, I look under
So
the
you do
woods
use a
lamp.
wood lamp?
I do,
Okay.
You used them?
uh-huh.
Yeah.
You don't notice, you don't feel anything. I turn off the light, I'm looking with a special magnification wood lamp. You're not noticing. It has
No.
a special light on it, it's quick.
It's
And
one
then-
of the question in the exam.
In class, we use, you guys will use
You'll,
it too.
yeah, toward the end.
The wood lamp is toward the end, but no one had, because we were doing facials all the time, we had. like,
The same
Literally.
color everybody,
Right,
so-
and it takes some practice to learn the different colors of the orange and the white and what you see.
And the
Yeah,
blue
And
and the
blue,
violet
and
the.
you'll see the pigment though, that shows
Yeah.
up often very
I know, I
dark,
saw that,
right?
it was pretty cool.
And
It's
that
one
was
of the
cool.
questions,
That
it says
is-
if it's appear on the wood
That
lamp,
helps you to know which
violet color,
Ultralux
what kind of
products
skin,
Yeah.
type
are
of
good
skin
for
is
their
it?
skin.
Yeah, they're
That
gonna
is
ask
your
all
They
that.
are gonna
You know,
ask.
back bar thing that you can do, because they don't have a woods lamp, to help you, I see more
I love
oil, I see more pigmentation, so now I know what Ultralux
Omega,
products to gear for your skin. And it just takes a minute at the beginning of
Is
the
it
facial.
Omega?
I just wanna see, are they all plant?
We have to wash the face first and then we can.
Yes, good question. So the woods lamp, I can look
Oh,
oftentimes both, because it'll go past the epidermis.
Okay.
But if I do it, and they have a lot of makeup on, sometimes it's a little harder for me to see. If they come with no makeup on, then I can see right away, right? Yeah.
Plants, they're all.
Right. But the woods lamp, I often do at the very beginning, because I can still see the oil and the pigment and the dehydration past the makeup, because it's going deeper
You
into
do
the
that
skin.
skin cleansing?
No, I usually
No.
do that when they first come in, I can see past the makeup for that. Not as well if I'm looking for things on the epidermis or the surface, I can't, right?
Is the lamp on
The woods lamp is sold separate.
right, but is this lamp on that apparatus?
No.
I didn't ask.
On this,
I'm asking, is that sufficient to use?
For just a basic consultation?
Uh-huh.
Yes.
And what's the difference between the two?
Well, the woods lamp is the one, this will not show you underneath the epidermis how much oil production there is, how deep the pigment goes.
Oh, so it's just
The surface epidermis, what you can
Epidermis
see
layer.
magnified, right? The one that comes in your combination equipment or by itself is usually like a 5 times magnification.
the wood lamp?
No,
Or this,
the
okay.
basic magnification
So
lamp.
what's the technology behind, or like, what makes this wood lamp be
So
able
I
to
don't
do
know
that?
exactly what they've done, but with the woods lamp, I definitely know that they've done something to the imaging so that I can see deeper into the underlying tissue. It's been around forever. If you wanna know exactly how the woods lamp was made, you can look it up, but there is an explanation of how exactly the wood lamp was made.
It's in the
forever.
if you guys have
But it's in
yeah.
your book, and some of
It
it
is.
might be on your test.
Yeah.
Most of us do have it. We just whip it out, it's not too expensive, and we can, kind of gauge from there also what kind of skin they have. It's just another tool to have in your arsenal to know what skin type they fall under,
Mhm.
okay? Okay, but it's not super expensive, and it's great to have. With the combination skin, a couple of the facials that Ultralux has is like the Lux facial with peel or the vitamin C facial. And when you become an Ultralux account and you order a certain amount, you get one of these type of books. Let me grab, this one, let me see, here is different. This is, see the esthetician manual? So this is depending upon, I don't know what the opening order is, but a certain amount of products that you order and you become an Ultralux esthetician, you will have in the back here all of the different facials that we use. So I'm just mentioning some that are for specific skin types that we're going through, okay? But for now, you can make a note of it if you want, right? So the combination skin is more like the Lux or the vitamin C facial. The normal skin can use what? The vitamin C brightening facial. They can also use that microvenom anti-aging facial. So you have a lot more choices with the normal and the combination skin. And usually both of those skin types would benefit from peels too. So you can either do our peel separately or in the facial. Both of those skin types would benefit from something like that, okay? But I still recommend a patch test, like we talked about, before any of the peels. So if the client comes in for a first-time facial, I don't necessarily recommend that you do our strongest peel the first time, maybe something gentler, like the hydrating peel, and do a little patch test with either the glycolic acid or the green tea peel to make sure there's no allergies, have them sign consent form, come up with like a treatment plan, and then continue with their next facial. Yes,
I have a question about the green tea peel. We have like classes before,
right.
and what we can do extraction before the green tea peel, or we have to do it after?
So you do the peel, and then you do their extractions usually. Why? Because if you did extractions and then the peel, you've got some open pores or lesions, that's gonna burn or it's gonna descend farther than you would expect in that
What about the
area.
dermaplaning? If they wanna remove the hair,
You can do
we
derma,
should do it after?
oh,
After
cause you
the-
wanna do the dermaplaning and you wanna do a peel, at the same time. It depends on what you're comfortable with, I've seen people do like a light peel and then a dermaplaning, and then others do the dermaplaning to kind of help remove some of the dead surface skin, and then the peel. Depends on the products you're using and the skin type you're working with, right? So not everything is one size fits all. That's why it's so important to know what kind of skin you're dealing with, so important, and what they're using, right? What if you're gonna do the dermaplaning and you're thinking to do a peel and this person is using Retin-A?
Right, it's gonna be in the burn, yeah.
Problem, might be able to do a light dermaplaning, certainly can't do a peel. Right, okay? Any questions yet? Okay.
No, you make it.
Okay, I'm gonna continue here. I'm gonna go on to the oily or acneic skin. Do we have to have acne if we have oily skin?
No.
We don't. Some people are lucky enough to have oilier skin and have no acne at all. Their skin isn't producing as many dead skin cells and clogging the pores readily, and they don't have as much of that P. acne bacteria on it, but they still have an oilier skin type, right? So with the Ultralux, you can definitely use on them things from the clear line. You can even use things from the vitamin C line. And did everybody feel this?
No.
Okay, this is the vitamin C serum. It's a 20% serum, that's a professional size. It has a little bit of hyaluronic in it, not to replace the hyaluronic serum, okay? But does add a little bit of that moisture to it. And it's great stuff. You see how it's in a dark blue bottle?
Yeah.
Block the sunlight, right?
The Ultra,
Do you see it?
because you have all the different formulations of,
That's the ultra
No.
vitamin C. That just
This
kind of tells
is-
you the essential oils that are in them.
so which one is this?
Yes.
Does this normally start clear and then like with
Over
time
times, they can oxidize, that's fine, right? As long as you keep your bottle out of the sun and you close it, that's okay. That doesn't mean your product isn't fresh, okay? And with the vitamin C, if they have a real sensitive skin, you might have them start with, one, not every night and go slowly, just to make sure.
Is this L-ascorbic or is it,
This one is L-ascorbic acid.
so are any of them PhD formulations? or-
I don't think so. I mean, we know that the science tells us that ascorbic acid, it does the best job.
Yeah, absolutely, but you
You know?
have to store it properly.
Yes.
Yeah.
Yes.
I got a reaction to a combination of the two products I put on my hand. Do you have something? I went and washed it off.
What kind of reaction? Oh, I see. What products did you use?
I used the toner,
Uh-huh,
then I put this
Yeah.
seaweed thing on.
okay.
And without the toner, when I just tried the seaweed, I didn't have a reaction.
Okay,
But putting
so-
both, do you have something soothing?
So
that
I
will-
have an irritation relief, and do you have also, Joyce?
Is that
the-
there?
No, I have the irritation relief,
You
so
do,
that
okay,
helps.
yeah.
Put a
Let me give
little
that
bit
to
of this here on, to help kind of, kind of calm it
That's the
down.
one, the comment, the.
And then we also have a recovery, so both of these kind of just calm the skin and have chamomile, kind of, kind of calm it
That's the
down.
one, the comment, the.
And then we also have a recovery, so both of these kind of just calm the skin and have chamomile in it. Some different little sea salts to help kill bacteria, so.
This is the one that helps with the redness, right?
Right.
Yeah, okay.
Thank you.
Question,
Right.
what's the difference between this vitamin C that you just passed versus the ultra vitamin C moisturizer?
So one is a moisturizer and this is a treatment serum.
Yeah.
So if their skin is appropriate for it, they can use, let me show you, this is the vitamin treatment and this is the vitamin moisturizer, right? So they could essentially layer on the vitamin C serum, the vitamin C treatment and the moisturizer. But you need to make sure you know their skin before you suggest something like that from the beginning.
No,
Thank you so
the,
much.
Are you
this is
going?
the,
Yeah, I have
all
a
the
client.
vitamins.
Okay, love,
Thank you so
we'll
much.
see you again, I hope.
All right,
And we're
thank
here
you.
for questions.
Yeah, thank you, thank
Absolutely.
you.
And you can touch those, okay? How's it feeling?
Really not good.
Okay, so the best
Oh,
thing
you
for you
can
to
do
do then is just, it's just one spot, right?
Yeah.
Okay, we'll watch it, we'll see. Don't, just for now, don't put anything else there, that's
What
for
would
sure.
nourish, what would nourish me? Because I see one says hydrates and one says nourish.
But, are talking about, well, one is more of a treatment, a vitamin C treatment that's a little bit heavier than the serum, and one is a moisturizer.
So she's talking about like
So the,
all these.
the vitamin C treatment is a little more stronger?
Yes, it's a treatment and it's not for, you wouldn't just use that, you also need a hydrator. So if you use maybe the vitamin C treatment, you could put that moisturizer on or a different moisturizer.
So this is a
on top of it.
moisturizer. Oh, no, the other one's a moisturizer.
this is treatment.
So just to clarify really quickly.
It's okay, yes,
The vitamin C, even if it oxidizes, it still fully works.
yes,
Okay.
but that would be different than if you just left it open on the counter, you know what I'm saying?
Because let's say I'm using a vitamin C serum, Neutrogena one to be exact, and it's like a little white bottle.
No,
It's
but a lot of them will have expiration dates on it too, check your dates.
it doesn't like one bottle will last a month.
How long?
Like a
Little?
month.
That's fine, a month, sure,
Very
you keep it
heavy.
closed tight
Yeah,
and
that's
out of the
heavy.
sun, right?
It's in my bathroom. Yeah.
You don't wanna necessarily
Very
leave your
heavy.
good serums in your bathroom exposed to the moisture of the bathroom, ladies,
That's a
and the steam.
That's interesting.
So
We're looking for a
treatment,
cool, dry place.
how you call it?
Ah, is that why they made those little mini
You could-
refrigerators?
Right,
Yeah.
cool, dry,
It's very thick, yeah.
perfect, exactly,
Moisturizer.
okay? So, the oily skin, we have different custom facials, and you would see that in the aesthetic book with peels, or we also have a